Good day to our colleagues. Good day as well as to our students. My name is Sibonelo Kumete. I am going to be the program director for today. Can I get the education from you, Ms. Chetty, and you as well, Dr. Hendricks? Whether should we start now or should we maybe wait for 2 minutes to allow maybe those who have not joined yet to join? Firstly, let me welcome you, colleagues and students, on this program of today under the slogan of Our Lives Matters, since you all know that we are in a mental health awareness month in October. So we have wasted enough time trying to allow others to connect. Let me not waste no further time. Let me call upon Miss Zamobuhle Dlamini, who is going to introduce our speaker. Ms. Dlamini, over to you.
Good day, everyone. My name is Zamokuhle Dlamini. I'm a student mentor based in Pietermaritzburg. Today, I'll be introducing our speaker. Our speaker, she's here today to speak about understanding and managing anxiety. Our speaker today is Michelle Scharnick. She is a qualified counseling psychologist registered with HPCSA, and she obtained her Master's of Social Science degree from University of KwaZulu-Natal. She is currently employed with Unisa as a student counselor in the Midlands region. Michelle has also been in a private for the past 4 years as a counseling psychologist, is offering individual therapy to adolescents, young adults, and adults. Michelle's passion is psychological well-being and holistic personal development. She practices predominantly from a cognitive behavioral therapy perspective, with her focus area and experience being in trauma, depression, anxiety, stress, and adjustments. So please join me in welcoming her. Over to you, Ms. Michelle Scharnick.
Thank you so much. And thank you to the KZN region for this opportunity to present. Let me just share my screen and we can get straight into the presentation today. So today I'm covering understanding and managing anxiety, looking at the signs, symptoms, and treatment. I also want to just say, thank you to everyone attending today, because today is a Mental Health Awareness Day, and you are part of breaking the stigma. So let's start to do that together in terms of our mental health awareness. So I'm going to jump straight into it and explain what is anxiety. So anxiety is an emotion, which means it falls within the range of emotions that we experience as human beings. It is not abnormal. But we are going to discuss when it becomes problematic. So you can expect that you would experience some anxiety. It's an emotion characterized by feelings of tension, worried thoughts, and physical changes like increasing blood pressure or heart racing or trembling or sweating. It incorporates both the emotions and the physical sensations, and of course the cognitive aspect that we might experience when we're worried or nervous about something. And although we find it unpleasant, anxiety is related to our fight or flight response, or sometimes it's called stress response, which is our normal biological reaction to feeling threatened. I wanted to just explain how it's related, but I'm going to do that very simply. This diagram might look complicated, but there's just a particular point I want to make in terms of this fight, flight, and freeze response. So when we perceive that we are in danger, whether it's an imagined or thought danger, or whether it's an actual danger, our nervous system is activated. And you can see on this diagram under flight, you see that panic, that fear, that anxiety, that worry, and that concern. So what happens is, if we have a perception of danger, and as the bell curve goes up, that's our perception of danger. Our nervous system's activated. We have stress hormones and adrenaline that's released. This is part of our fight or flight response. And that's how we then experience physical symptoms of anxiety. And as our perception of safety increases, then our sympathetic nervous system then goes back to being calm. So the purpose of this happening is actually adaptive. It's there to help us, because think about if you are, let's say, being mugged, or a dog is running after you when you're walking on the road. You need your body to respond quickly. And so the nervous system is actually helping you to do that. So it helps to keep a person alert and focused and ready to deal with a threat. When we're looking at anxiety disorders, remember there is fear. So there is a perception of danger, even if it's in the form of, for example, failing an exam, or in the form of worry. There's still the perception of danger, which then activates the nervous system, and that is why we then get those symptoms of anxiety. Some of the common anxiety signs and symptoms. These are generalized symptoms that I've put here. The reason why is I'm going to take you through this systematically in terms of how we get to looking at whether it's an anxiety disorder or not. So as psychologists or clinicians, we often use an inventory, which is the Beck Anxiety Inventory, to be able to assess whether it's severe or mild or moderate anxiety that someone is experiencing. Your clinician will score this and interpret it. But these are some general anxiety symptoms: feeling nervous and restless, having an increased heart rate, sweating, trembling, feeling unsteady, having trouble sleeping, trouble concentrating, difficulty in breathing, difficulty in controlling worry. Sometimes something that's quite common that a lot of people don't know is indigestion, that you might experience that, feeling faint or lightheaded, getting hot or cold sweats, unable to relax. That's quite common. Numbness or tingling. So these are some of the physical anxiety symptoms that you would experience. And they're quite common in terms of, generally, if you are anxious about something, you might experience one or two. Now we've got to look at when anxiety is actually a problem. So remember I said to you, it's part of the normal human experience. You write a test, you feel a bit nervous or anxious. You do your driver's license, you feel a bit nervous or anxious. You're presenting something at work, you feel a bit nervous or anxious. So feelings of anxiety are a normal response to life challenges, but when does it then become actually problematic? And it becomes problematic when it's out of proportion to the situation, where the level of fear of anxiety is not in proportion to what the actual situation is and what the actual maybe concern or threat might be in the situation. It's problematic when it's persistent, when it's uncontrollable, when it's overwhelming. It's problematic also when it's present daily. So from the time you wake up in the morning, there isn't any obvious trigger, but you're feeling anxious. It's problematic when it's interfering with your social life, your occupational life, or your studying, or any other important area of functioning. So for example, just your normal routine is now being interrupted by anxiety. That's when it's problematic. And it's also problematic when it's not short-lived. So remember that response that we get from our nervous system, that should be a short-lived response. But if it's not, and it's starting to be long-lasting, and it's starting to then pervade different areas of your life, it's a problem. It's also a problem when it's excessive. So when the worry becomes excessive, and maybe it's not just about everyday problems now, it's also about things that may or may not happen. So the next step is being able to, and your psychologist or your student counselor will then be able to determine, okay, now you've come in, you've told them the symptoms you're experiencing, you realize that it is problematic. Your clinician or psychologist is now going to look at what type of anxiety disorder are you dealing with. And today I'm just going to touch on some of the common ones because there's quite a few and we don't have time for all of them. So there's a number of anxiety disorders. There's generalized anxiety disorder, and the main feature there is persistent and excessive worry about different activities, and it could be more than one area of activity. Social anxiety is when there is fear or anxiety about social situations or performance situations where there's a possibility of being exposed to scrutiny by others. Phobias is when there's persistent and excessive fear around particular object or activity or situation. So for example, maybe using public transport or flying in an airplane, or afraid of injections, for example. And then panic disorder is when you are experiencing recurrent panic attacks. So I'm going to go into detail with just a few. But before I do that, let's look at the prevalence of anxiety disorders. So how common is it to have an anxiety disorder? So the Anxiety and Depression Association of America indicates that anxiety disorders are actually the most common mental illness in the US, affecting 40 million adults, 19.1% of the population, and this is from age 18 and older. So let's bring it home and look at our current stats from different studies and from different institutions. In 2016, the prevalence rate was 16.5% for common mental disorders. That's anxiety, mood, and substance use disorders. So look how close that is to the US, meaning it is something that is a problem for us or is common for us. In 2021, SADC reported that 1 in 3 South Africans will or do have a mental issue in their lifetime. And in 2022, there's a national survey that was done from a VIT study, which indicated that the overall probable depression and anxiety across South Africa ranges from 14.7% to 38.8%, indicating that actually South Africans suffer higher rates of probable depression and anxiety than other countries. And this could be attributed to many factors, which I'm not going to get into today. But the point I want to make is that it is common. So let's break the stigma. People might not be talking about it, but let us break the stigma to say that actually it's not a common experience for us as South Africans to have an anxiety disorder. Actually, it is common. But what the problem is, we don't get people seeking help. So there's a very small percentage of those people who are experiencing anxiety disorders that actually seek help. One more point I want to add in terms of prevalence. Studies have revealed that women have consistently higher prevalence rates of anxiety disorders than men. And these are studies that are dated recently. So for women, there is a higher prevalence rate of anxiety disorders, and there's a number of reasons for that, but just to indicate that it is common among women. So anxiety disorders among adults. Remember I said when your psychologist checks to see and scores and interprets the Beck anxiety inventory, they will be able to tell you if it's mild, if it's moderate, or if it's severe. This is just an indication here that from the National Institute of Mental Health, that actually we just can look at the percentages to see that actually 43% of those reported are saying there's mild impairment, 33% there's moderate, and 23% there is severe. So even in terms of having an anxiety disorder, the type of impairment you might experience or the impact of your anxiety disorder might differ for each person, which is absolutely normal. So I'm going to touch on the common ones now, and I'm going to go into a little bit of detail. The reason why I want to go into detail is just for you to, as I've gone through the presentation, kind of gauge if the symptoms you might be experiencing or a loved one experiences falls into any of these categories, and then, you know, being able to get help for that. So we've got generalized anxiety disorder, and it's really, like I said, the characteristic here is that excessive anxiety and worry, and it can be about a range of different topics or activities, and your worry is occurring more often than not. So there's more days where you are actually worried or anxious. The worry is experienced as difficult or challenging to control, and then you have physical symptoms associated with this. And your physical symptoms is your restlessness or feeling on edge, being easily fatigued, struggling with concentration, so struggling with being able to concentrate in terms of a task that's on hand. So you can't control those thoughts, those worrisome thoughts, your mind going blank sometimes, irritability, muscle tension, and difficulty in terms of sleep. So that could be difficulty falling asleep, staying asleep, being restless when you sleep, or having an unsatisfying sleep. So adults with we call it GAD, they often worry about everyday routine life circumstances, such as job responsibilities, health and finances, health of family members, misfortune to their children, etc. So what you will find, the characteristic of generalized anxiety disorder is it is a worry about everyday life routine circumstances. Okay, so that is, and of course, the one thing I just want to mention with GAD is that it can be different in intensity and duration and frequency of the anxiety or the worry, but it is out of proportion to the actual likelihood of the impact of the anticipated event. So what I mean by that is, let's say you are worried about a misfortune coming to your child, for example, or misfortune maybe coming to a family member. The anxiety and worry you're experiencing is way out of proportion to the likelihood that that misfortune is actually going to happen. Okay. And I'm telling you that because when we talk about treatment, that really becomes important. And remember, I said to you that perception is very important in terms of activating your nervous system. So let's look at social anxiety disorder, also a very common one. This is persistent fear or anxiety about one or more social situations or performance situations. So, for example, making a speech or presenting, and the specific thing in the performance and the social situations is the person is exposed to possible scrutiny, so possible negative judgment. Examples of social interactions is having a conversation, meeting an unfamiliar person, being observed eating or drinking, or like I said, performing in front of people. So the social situations are then almost always provoking anxiety. The person is afraid that the way they act, or that by showing anxiety symptoms, they will be negatively evaluated. So maybe they're afraid that they're going to be judged as anxious or weak or crazy or stupid, or boring or intimidating. And again here, the degree and the type of fear and anxiety can vary. So it won't necessarily be the same as the next person. Some people might be experiencing panic attacks when they have social anxiety disorder. Other people might be experiencing anticipatory anxiety. And this is when anxiety is occurring far in advance of maybe an upcoming situation, an upcoming social event, or an upcoming performance. So another symptom here is that the social situations are either avoided, so that you're going to avoid the social situation, or you're going to endure it with intense fear. Like I said, again, with this disorder, like GAD, the fear is out of proportion of the actual threat. So the anxiety and fear you're experiencing is way more than the actual threat that is posed in the situation. And then lastly, the fear, the anxiety, and the avoidance is again interfering with your normal routine, interfering with your occupational or academic functioning, or your social relationships. Okay, and now we move on to post-traumatic stress disorder. This PTSD, as we call it as psychologists and clinicians, does not necessarily fall under anxiety disorders, but falls under the trauma and stress-related disorders. But why I've included it is because it's very common within the South African context that people experience PTSD. And as I go through it, I think you will understand why, given some of the circumstances that we face within our country. So firstly, with post-traumatic stress disorder, the first important thing here, unlike generalized anxiety disorder and unlike social anxiety disorder, it isn't a worry about something that could happen. It isn't a fear about judgment. Something has actually happened with post-traumatic stress disorder. So a person is exposed to death or threatened death, actual or threatened serious injury, actual or threatened sexual violence. So this could be direct exposure, meaning it's happened to you. It could be that you've witnessed it. Maybe you were at a mall and you saw something happening, or you were in town, or you were in your neighborhood and you saw something happening. You can also experience it from learning that a close family or close friend was exposed to trauma. And then for those who are your first responders, your police officers, and even sometimes psychologists, when you are social workers experiencing repeated or extreme exposure to those adverse details of the traumatic event, that also could allow for post-traumatic stress disorder. And then there are categories of symptoms. So with post-traumatic stress disorder, in order for your clinician or your psychologist to diagnose, they will check each of these categories and they will check the criteria, and then they will be able to make a diagnosis as to whether you are experiencing this. But for the sake of our talk today, I'm going to briefly go through some of the categories and the symptoms under those categories so that you could also be able to identify if maybe you have been exposed to any of that, whether you are experiencing post-traumatic stress disorder. So there's the intrusive symptoms. What's most common under intrusive symptoms is getting recurrent distressing memories of the traumatic event, getting recurrent distressing dreams or nightmares about the event, experiencing flashbacks about the event. And sometimes with experiencing flashbacks, it can be an extreme expression where you get that picture just popping into your mind about what happened. And some people can experience complete loss of awareness of present surroundings when they get a flashback, but that is an extreme expression. Also, an intense or prolonged psychological distress if you're exposed to any kind of cues that remind you of the event. So those are the most common ones under intrusive symptoms. When it comes to avoidance, it's about avoiding feelings, avoiding thoughts, avoiding memories, and avoiding any external reminders, which could be people, conversations, activities, objects, or situations. So let's say you were mugged and you had a specific way that you walked normally to get your transport, or that you walked to the shop, for example. Now you no longer go that way, you will take a different route. This is what the avoidance of maybe an external reminder would be. And then you get negative alterations in cognition as well as mood. Cognition is our thoughts. So the type of changes here would be the inability to remember important information about the traumatic event, having persistent and exaggerated negative beliefs. This is really important, and something I would like to just highlight with post-traumatic stress disorder is your beliefs. It can shift your beliefs, but it shifts it to be exaggerated negative beliefs. It can be about self, can be about others or the world. So for example, feeling like the world is just an absolutely dangerous place. I can never trust anyone again. I will never be safe again. These are these exaggerated negative beliefs that can take place. And then persistent, distorted cognitions about what has caused it. So there's a lot of self-blame that can take place as well. And then in terms of emotions, persistent negative emotions, so anger, shame, guilt, fear, not being interested anymore in certain activities, significant activities, or not participating, feeling sometimes estranged from people or detached from people, and then the persistent inability to experience positive emotions. So that's quite common, where the person suffering with PTSD struggles to experience happiness, satisfaction, or loving feelings. Lastly, alterations in arousal and reactivity. This includes irritability, anger outbursts, where there's no real provocation. It includes reckless or self-destructive behavior, like driving dangerously, drinking excessively, self-injury, or even suicidal behavior. It includes what we call hypervigilance, which is just being watchful all the time. So checking over your shoulder when you're walking, checking your surroundings, who's around you, how close are they walking to you. Then there's your exaggerated startle response. This is when you jumpy to, for example, any loud noise or unexpected movement. There's also problems with concentration, and then sleep disturbance as well. So difficulty to fall asleep or maintain sleep, but that would be due to nightmares or safety issues. So for example, a client of mine really struggled to fall asleep due to the fear of maybe somebody is in the yard. So that would be, for example, the reason why the sleep disturbance would happen. So this is very common because of basically some of the circumstances in South Africa. But again, a lot of people are not seeking help. Lastly, panic disorder. So just to explain what a panic attack is, it is an abrupt surge of intense fear or discomfort, and it reaches a peak within 10 minutes. So I just wanted to point out, although I'm telling you it reaches a peak in 10 minutes, it doesn't mean that it only lasts for 10 minutes. How you manage it, how you respond to it, will then indicate how long a panic attack will last. A panic attack is accompanied by physical symptoms, and these are the range of symptoms that you can experience. your heart pounding, sweating, trembling or shaking, sensations of shortness of breath, feeling like you're choking, chest pain or discomfort, nausea, feeling dizzy, unsteady or lightheaded, chills or heat sensations, numbness or tingling sensations, derealization, which is feeling detached from reality, depersonalization, which is detachment from self, fear of losing control or going crazy, and fear of dying. Note, this is happening while you're having a panic attack, and it's peaking, it's getting progressively worse within those 10 minutes. So you can have a panic attack and not have panic disorder. So you could have social anxiety disorder and you can have panic attacks. You can have post-traumatic stress disorder and you can have panic attacks. When it is a panic disorder is if you have recurrent, unexpected, so it's reoccurring panic attacks that are coming out of the blue with no specific trigger. What I mean by that is maybe with post-traumatic stress disorder, when you're getting a flashback, then maybe that is triggering the panic attack. Whereas with panic disorder, there's no apparent trigger. And then the other thing that qualifies it then as a panic disorder is if one of the attacks you have is followed by a month of persistent worry, either about another attack happening or about consequences. So consequences is like losing control, having a heart attack, going crazy, social concerns like embarrassment or judgment, or if there's a change in behavior related to panic attacks. So you're reorganizing your daily life to ensure that if you have a panic attack, there is some help available, for example, or you're restricting your usual daily activities like leaving the house or going to do shopping. And then we would say you have then a panic disorder. So let's look at some treatment. You heard in the introduction that I predominantly practice from cognitive behavioral therapy perspective, so I'm a little bit biased, but I will touch on some of the others as well. Treatment is psychotherapy, so it's important to contact a student counselor or contact a psychologist and start the process of psychotherapy if you can identify that, you know what, I think based on these anxiety symptoms and based on what I've heard, I think I have an anxiety disorder. CBT has been proven to be effective to treat anxiety disorders. It focuses on teaching you specific skills to improve your symptoms and gradually return to activities you've avoided. It can include exposure therapy, in which you gradually encounter the object or situation that triggers your anxiety, so you build confidence to manage the situation and manage the anxiety symptoms. I've put it here because it does have the most evidence-based studies in terms of treating anxiety disorders, and there is really a good success rate in treating anxiety disorders with cognitive behavioral therapy. Cognitive behavioral therapy also looks at, based on its name, cognition. Why this is really important is, remember right at the beginning, I spoke about how perception of danger can then trigger the activation of your nervous system. And you would see as I went through the different anxiety disorders, with generalized anxiety disorder, also with your social anxiety disorder, even with panic disorder, you are dealing with an out of proportion anxiety than what could actually happen in the situation, which means one has to evaluate cognition. And what tends to happen when we're looking at evaluating cognition, we're looking at two things: how you've evaluated the danger and threat, and how you've evaluated your ability to cope. So both of those things become important because they're either going to increase anxiety, as you can see on the screen, or they're going to decrease anxiety. So with CBT, we do some work and some skills around cognition in order to not only start to deal with the anxiety symptoms, but also to deal with the perception which can trigger the anxiety symptoms. Medication can be part of the treatment. It can go hand in hand with your psychotherapy. Remember, your psychologist or clinician is going to be able to see whether those symptoms of anxiety are mild, moderate, or severe, and that can give an indication as to whether it's just psychotherapy in terms of treatment or a combination of psychotherapy and medication. So there are several types of medication that's used to relieve symptoms depending on the type of anxiety that you have. And it's really important to be consulting either your psychiatrist or your doctor, because they also need to take into account before prescribing to you whether you have any other mental or physical health issues. So we get certain antidepressants that are used to treat anxiety. So certain antidepressants don't just treat depression, but they treat anxiety as well. So that might be prescribed. You get some anti-anxiety medication that might be prescribed. And then you get a category of medication that is sedative, which is your benzodiazepines or your beta blockers. This category of medication, I want to emphasize, is for short-term relief of anxiety symptoms, and they're not intended for long-term. And that's why your psychotherapy becomes important, is because some of the medication you're on is not intended for long-term use. Okay, whereas your antidepressants and your anti-anxiety medication are used for longer-term use. Right, then we're looking at a little bit of self-care, and I just want to emphasize, you know, that self-care isn't just about bubble baths and spoiling yourself, etc., etc. No, when we're talking about self-care in terms of mental health, we're talking about actually taking care of different aspects of your daily life, which then allows relief of symptoms. So a healthy diet is really important, because as we've discovered with studies over the last couple of decades and years, that food affects mood. So it's really important what you're eating. I would suggest consulting, whether it is in a local clinic, consulting a nurse, those that have access to medical aid, consulting a dietitian, so that you can find out about what a healthy diet is for you and your body. When it comes to anxiety, we need to reduce caffeine intake. That's really important because caffeine increases anxiety. So those people that love to drink Red Bull, play, take BioPlus when they study, this is not the best option if you're already experiencing anxiety symptoms. Sometimes caffeine can also induce anxiety symptoms, so please be mindful of that. And then reducing alcohol. Excessive alcohol also increases anxiety. And then your physical exercise, movement is so important because it reduces stress, anxiety, and depressive symptoms. So it's really something to incorporate into daily life. And then stress management is also important because stress can often then cause anxiety symptoms. So even if at this point you're just having a few anxiety symptoms and you don't feel that maybe it's mild and the main cause is stress, then stress management, consulting a psychologist to help you with stress management becomes really important. And then there's some helpful strategies to regulate the nervous system. So often with PTSD, post-traumatic stress disorder, there is the result of a dysregulated nervous system depending on how long one hasn't sought any type of treatment. But even with the other anxiety disorders, your system can get dysregulated based on not having managed the anxiety disorder. So there's diaphragmatic breathing, And I'll get into that if we have any time left. There's singing and chanting, essential oils, cold showers or infrared saunas. Cold shower just means right at the end of the shower, you move it to cold just for 1 minute. Okay. Probiotics is important. Our gut health is related to our nervous system. Meditation is also important. There's specific therapeutic techniques. I've mentioned them because maybe you would want to, when you are looking for a psychologist, see if they use some of these techniques, because they are really helpful in terms of regulating the nervous system. So EMDR, eye movement, desensitization processing. EFT is the emotion freedom technique, and SE is somatic experiencing. Positive social connection, this helps. Gratitude, you can find lots of gratitude exercises or gratitude journal online. Being in nature, this is really helpful in terms of our nervous system. Laughter and prayer. And then I just wanted to really emphasize that it's important when you are experiencing anxiety to learn relaxation techniques. So relaxation is not a matter of doing nothing, or it's not a matter of being on holiday and there's just no activities to be done. That doesn't result in relaxation of mind and body. What does result in relaxation is mindfulness, meditation, breathing exercises, and grounding exercises. Like I've said, relaxation techniques, which means it's something that you get to learn. I love this picture about mindful, because that's what mindfulness is about. It's about learning the skill of being able to focus your mind, being in the present, and it allows you to better control and manage thoughts and emotions, and even being able to separate thoughts and emotions. So it is a skill, and it just allows for better focus and better control, and allowing yourself to figure out how to come back into the present when you do have those flashbacks, or you do have those worrisome thoughts. Meditation. So there's a lot of, you can Google mindful meditation. It's a proven way to reduce stress and anxiety. It also allows for a deep state of relaxation. Remember, one of the symptoms of anxiety is being unable to relax. So meditation allows you to get into that deep state of relaxation. Breathing exercises, they are really helpful. It reduces your baseline of anxiety. It's often recommended to do a breathing exercise twice a day, in the morning and in the evening or afternoon, just to reduce. When I say reduce, it's not to eliminate anxiety, but to bring that baseline of anxiety down. It helps you to relax. It can slow your heart rate and reduces your blood pressure. Then you have the grounding exercises. You can Google grounding exercises. Basically, it helps you to deal with symptoms of flashbacks. So it's really good if you are experiencing post-traumatic stress disorder, or if you're just struggling with thoughts, like worrisome thoughts. So it just helps you to pull your attention. It's a skill, helps you to pull your attention away from the thoughts or the memories or the flashbacks, and refocusing on the present. And there's different types of categories with your grounding exercises. There's one to do with your senses. There's one that deals with categories. There's another one about body awareness, and then there's one about mental exercises. So you find one that suits you, because everybody is different. So you know what would suit you and what would be effective for you. So these are some apps that I have found really helpful in terms of clients and in terms of students as well. Mindshift CBT, it's to do with anxiety. This is the icon here, the blue face, when you are looking for it on your Play Store, when you're looking for it in your Apple Store. Then there's Calm. You can see Calm's icon there. It's for self-care, for sleep, for meditation and relaxation. Calm is also free up until a certain point. Headspace is not free, but it's really good for mindful meditation. And I've had a lot of good feedback about Headspace. And then you've got your support groups. So SADC hosts a number of support groups for different categories of people, for mothers, for women, for young adults, and they do have groups for depression and for anxiety, which is really, really helpful. Okay, I don't know if we still have time, or I just need to leave some time for questions. Mr. Program Director, if you can just give me an indication.
Dr. Hendricks, should you allow questions and answers, or should the presenter continue?
Michelle, I'm thinking you're wanting to do a exercise with the audience, and I think that would be great. And then we can leave. We did start late, and I think to be fair to our speaker, we will give her the time to do the exercise and then leave the rest of the time for questions.
Okay, perfect. Thank you so much, Dr. Hendricks. So I just want to indicate this diaphragmatic breathing. It's really helpful in terms of taking deep breaths. When you're having a panic disorder, or when you're experiencing a panic attack, or if you have panic disorder, you tend to hyperventilate. So you're taking short breaths. This helps you take deep breaths. It helps you get oxygen in. It helps to relax you. It helps to slow your heart rate down as well. Okay, so let's just, wherever you are, let's get comfortable. If you are sitting in a chair or you are laying down, wherever you are, if you're in the computer labs, it doesn't matter, you're sitting next to someone, just get comfortable with where you're sitting. I'm going to just take you through this. We're going to just do it twice, just so we don't waste too much time and we can still get some questions in. But basically, let me give you the instructions first. I'm going to be asking you to put your hand just above your tummy. I'm going to be asking you to take a slow, deep breath in. You're going to feel your lungs fill with air. Your abdomen is going to expand, so you should feel your hand moving. And then as we exhale, your abdomen is going to contract. So let's get comfortable wherever you are and just follow my instructions. So let's place our hand just above our tummy. Slowly take a deep breath in and feel your lungs filling with air. Hold it there. And now exhale and feel your abdomen contract inwards. So let's do it one more time. Slowly take a deep breath in. Feel your lungs fill with air. Your abdomen is expanding. Hold it there and exhale and feel your abdomen contract. So if you're having a panic attack, or if you have panic disorder, this is really great in terms of learning to take deep breaths and really beneficial as well. I did have a video about the 4-7-8 method, but I'm not going to show it. Google it, please. This is also another breathing exercise. And this is really helpful for relaxation, as well as if you experience sleep difficulties. So you can Google this breathing exercise. It's also really, really helpful and can be used for any anxiety symptoms or if you experience any of the anxiety disorders. So I've come to the end of my presentation. Thank you so much for this opportunity, and thank you for listening. And I think we would now open the floor to some questions.
Natasha says, my anxiety specifically with regard to tests and exams stems from other underlying health conditions that results in me taking longer. So I already know I will not finish the paper. I try to manage this by reading paper and answering what I'm confident with. I, however, still have anxiety when writing. What tools can I do to assist me with this? What can help me? What tools, what strategies can I put in place to help me deal with test and anxiety? Is what a question from the floor.
Okay. So what I would really suggest is, besides the preparation, because what I can hear you saying is that you are preparing, but there is that thought of knowing that you're already not going to finish, which obviously is then increasing the perception of threat in the situation, which is threatening to your performance, threatening to whether you're passing or failing. So I would really suggest, using some of the tools that I have already indicated, but I would suggest psychotherapy, because it's really important to be able to deal with some of those thoughts, to deal with how to respond to some of those thoughts, which are obviously increasing the anxiety symptoms, and causing you to still experience anxiety, even though you are preparing yourself for the exam. So my suggestion is really being able to get into some psychotherapy to deal with the cognitive part of things. And then I would just suggest in some of those the self-help strategies, being able to do the breathing exercises, being able to maybe use some of the apps, and even with the meditation, or even some of the grounding exercises, that would be really helpful. But psychotherapy is, I would say at this point, recommended.
Thank you. Thank you, Michelle. The next question is about PTSD. I know you addressed some of this as we spoke, but how, there was a question from the floor, how do we handle PTSD? How I suppose it's a broad question after a home invasion, for instance, and suffering from PTSD. What would be how do you manage that?
Okay, so definitely we have to acknowledge that it would be difficult to manage those symptoms on your own. So again, my number one, I started off with treatment, and the number one is psychotherapy, and that's being able to talk to someone about the incident, being able to then, because your psychologist is the person who's going to help you manage those different cluster of symptoms. So maybe you're having flashbacks. Your psychologist can help you with maybe teaching you those grounding exercises to manage the flashbacks. Maybe you're having that negative, exaggerated beliefs. The psychologist can help you to cognitively find strategies to deal with that. So I'm going to, again, I must sound like a stuck record, I'm sorry, but I'm going to recommend the psychotherapy, because there are, yes, you can, all the strategies I've mentioned, you can use. So you can use the grounding exercises, you can use some of the relaxation techniques, but in conjunction with the psychotherapy, your psychologist can basically hone in on your specific trauma symptoms and give you the skills and the tools to be able to actually overcome that based on specific symptoms. But just to also just emphasize that, people do recover from post-traumatic stress disorder, and also that with treatment, you will find those symptoms starting to decrease. Dr. Hendricks, did you want to comment?
Yeah, I just wanted to come in there, and just endorse what Michelle's just saying, that it's not even a broken record. It's talk therapy is a must.
Yes.
Severe anxiety disorders like PTSD, for instance, are processed through talk therapy. There's no quick fix. There's no band-aiding through medication. Yes, medication does help, and it's a supplement to what your therapist would be doing for you. The point of talk therapy is the opportunity to process. Through processing with your therapist, you get rid of a lot of the misperceptions and the cognitive distortions that you might have about what has happened to you. If you just look at, for example, rape trauma or even a home invasion, people engage in things like guilt and self-blame, and that actually makes the response to whatever happened even worse. So when you talk to a therapist through the processing, you are able to be more rational, because in your own mind, you would become very irrational. That's where the cognitive distortions come in and so forth. So with your therapist, she helps you to think more clearly. She helps you to get rid of some of the cognitive distortions. She helps you to make sense of why things happen. She normalizes it for you as well, so that your thought processes can then, be corrected. So I don't think I've ever heard of anxiety being dealt with an either or kind of management. It has to be both. Often it's both with anxiety. When I say both, I mean both medication as well as talk therapy. The modality that your therapist uses, it just depends in terms of what you're suitable for sometimes, or what they get the most improvement on. So CBT and cognitive therapies have been shown through research to be the most, I think, have the most kind of improvement in symptoms, in reducing the symptoms. So, and the other thing is about PTSD. Before it gets to PTSD, there's something else called acute stress. So the idea is that when you've experienced any kind of trauma, that you start talking about it as soon as you can and as soon as you're ready, so that it doesn't develop into a post-traumatic stress disorder per se. I just wanted to add that. Thanks, Michelle.
Perfect. Thank you, Dr. Hendricks.
I think there are some questions in the chat still.
Yes.
How does one deal with social anxiety disorder that they have lived with for years?
So I would really say, if you've lived with it for years, that seeking help is your first step. You could do all the self-help, and you could implement all the other aspects that I've spoken about in terms of treatment, but being able to get the help from professional becomes important if you've experienced it for years, due to the fact that actually now there are probably some consequences from living with it for years. But one of the techniques or part of the therapy that is very common with social anxiety disorder is some exposure therapy, which means not avoid social situations. So reducing that in terms of that avoidance to build up your sense of self-efficacy, to build up your coping skills. But this must be done in conjunction with your therapist, because then your therapist, he or she, is going to help you to do this in a manageable fashion. But one of the things with social anxiety disorder is to start to minimize that avoidance. And that will be in conjunction with the therapist that will help you do that and build up your coping skills. I hope that answers your question.
Okay, thanks, Michelle. Candice, I think that was the last question from the chat box.
Correct, yes.
Yes, if that's
Sorry, colleagues, there's just, I'm not sure if you saw the last question, which was, can we be put in contact with the therapist through Unisa? I'm assuming that we have posted the links in the chat, the booking app links for students to book appointments with counselors. We have counselors in each of our regions. We will put the booking app link, and you can select a therapist in your region that you'd like to meet with for a session.
So on behalf of Unisa Counselling and Career Development Unit in both KZN region and Midlands, we would like to express our heartfelt gratitude to our speaker, Ms. Michelle Scharnick, for an excellent, insightful, and informative presentation on managing and dealing with anxiety. We would like to express appreciation to all attendees, students, staff, for their participation and engagement and time given to attend today's presentation. Special thanks also to our manager and our regional director support, as well as the regional director support in Midlands, for allowing Michelle to do this presentation with us today. There were such good strategies and information shared that you provided, Michelle, that I think I speak on behalf of everyone. We really found that valuable. I encourage the audience as well to apply the knowledge they gained, to refer to those resources and to use that. And as you mentioned, the importance of seeking help or support where needed. We trust that the information shared has had an impact on all who attended. And I would like to encourage you all to attend the rest of our sessions. Tomorrow we will be addressing adult ADHD on the 11th. And then on the 12th, we will have a talk on bipolar, mood disorder and depression, as well as suicide awareness and prevention. Both of those days we start at 12. In conclusion, I'd like to request that you please complete the evaluation form for today's presentation. We really appreciate and would appreciate your feedback. Once again, thank you all for your participation and engagement. And lastly, Michelle, once again, thank you so much for an excellent, well thought through, helpful presentation. Very informative.
Thank you, Candice, and also thanks to you, colleagues, and to our students. You've been such a wonderful audience. We're looking forward to see you tomorrow as well. Enjoy the rest of your day. Thank you very much.